Morning, everybody. I just want to say, moments like these are the culmination of a lot of effort for months and months and months, and it really it comes down to leadership. I mean, it really is all about people who had vision and pursued it against a lot of barriers, a lot of odds, and made it happen. I mean, when you talk about HCR Commissioner Darrell Towns, I mean, he's gotten supportive housing for years and years. You just have to go back to his old assembly district and you see the kinds of supportive housing residences that are out there. They're beautiful, and they wouldn't have gotten done without his support. He was often the first person there saying, we need to build this, and he took that legacy with him to HCR and has made HCR a leading provider, a leading developer of supportive housing, and it's really, something to see, and this is one of the reasons that we're able to do this. When you talk about creative financing, you're talking about Mark Yar at HDC. He's not here today, but he's behind a lot of the innovative things we've been able to do, and it wouldn't have been able to be done without him. And then NYCHA Chairman John Rea, I can't really say enough about him. He came to us and said, how can we work together more? And he came to us and said, this is what I'm trying to do here at NYCHA. How can you help me, and how can I help you? And I think this is a great start. I mean, you can hear all the residences that we're already working on, and many of the members here in this room, and then to move forward with new land and Section 8s to project base. I mean, this is the beginning of a beautiful relationship that I think is only going to grow, and it's going to show us how we can take what we learned within our supportive housing residences and open it up to the community, open our doors to the community, and use what we've learned to serve people throughout the community in NYCHA housing and beyond. And then finally, for HPD Commissioner Matt Wambua, he had a vision. On our second meeting with him, we went in, we had our list of demands. I think we were going to ask that we have a smaller turning radius in the bathroom, and I think we wanted to speed up change orders or something like that. He comes in, he gives me one of those big old Matt Wambua man hugs. And I think, well, usually that's probably a good sign when the commissioner starts a meeting by giving you a hug. He sits down and says, I want to double supportive housing. Double supportive housing production. Well, we all try to keep cool. We say, all right, yeah, this happens to us all the time. And so he said, there's going to be some things, it's aspirational, but we want to try and do this. So we left the meeting hopeful but skeptical. A week later, Washington cut the federal home budget, which is most of the capital for supportive housing, so much that it reduced HPD's home budget by 46%. We thought, well, that conversation was quick, that's over. And he said, no, and he got more resources towards supportive housing within HPD, and he went to these other agencies and said, this is what I want to do, what do you need? And he made it happen, and it was his persistence, his leadership to work with these others, and between the four of them, they got this done, and it's really, really something else. I just think it's great. So now for our second act. I've been spending the last, we've got an embarrassment of riches today, basically, and I've been agonizing over the last week how to make sure that one significant announcement doesn't step on the other, because this is basically the best series of announcements that we have. We talk a lot about Medicaid redesign, and that's because that's been one of the major endeavors in the state government for the last year and a half. It's a necessary one. I mean, since 2008, every state government has struggled to balance its budget, and balancing your budget when you're a state, that means figuring out a way to reduce Medicaid costs. And every state, just about every state, has cut Medicaid costs by reducing eligibility, restricting services to certain populations, and it's really had some disastrous consequences all around the country. Here in New York State, they did it differently. Under Governor Cuomo's Medicaid redesign team, they brought every stakeholder into the room together and said, how can we do more with less? How can we take this as an opportunity to figure out innovative ways to not just reduce costs, but actually improve care. And it wouldn't have happened without the team that I'm going to bring up now, but it really has been an extraordinary exercise, and I've been so impressed by the way that the people in the state government, at the Department of Health, at OMH, at OASIS, at OTDA, and at HCR have been working on this. One of the main things that happened was that for the first time, maybe not the first time, but really significantly, the healthcare world got that the most important social determinant of health is housing. And that's a huge thought for the mainstream healthcare world to digest, but they've got it. And a lot of that had to do with the people in this room. Not just your advocacy and education over this last year and a half, but the work that you do to make supportive housing the success that it is really got their attention. And so we're lucky to be where we're at today, where we not only have an announcement that the city is going to double supportive housing production, but we also are talking about $75 million of annual appropriations for supportive housing under the Medicaid cap being spent for high-cost Medicaid recipients. This is huge. This is going to be huge. And most of us remember this from when the state budget got passed, but it really didn't get the attention that it deserved, because if we can get the federal government to match this, it could go up to 150. In the legislation, closures of nursing home beds, closures of hospital beds, some portion of those savings will be reinvested into supportive housing. So it could be even more than that each year going towards supportive housing production, operations, and services. It's up to us to make it happen, but I'm going to bring up the people that had the vision to make this happen, and we're going to talk about just what this means. It's, I think, a sea change in the way we work on these things. Just as we said we were the solution to homelessness, and then just as we were able to make New York City the metropolitan area with the lowest number of chronic homeless people in the nation because we focused supportive housing resources on them, we are now going to bend the cost curve on the Medicaid spend by using supportive housing to house the most vulnerable, high-cost Medicaid users.